It is estimated that about 15,000 birds in Ghana are affected by sickle cell disease every year. The chronic nature of a sickle cell disease and its complications can make the treatment of the condition very expensive. Management of sickle cell disease can put a strain on families' income. Mother of 5-year-old Joel shares her ordeal of dealing with her child's condition.
The other siblings are there, and anytime that I take money, it's like I'm going to hospital. So it's like when the money comes, it's on our agenda, on drugs.
President of the Sickle Cell Foundation of Ghana, Professor Kweku Ohenefrempong, has assured sickle cell patients that their burden will now be lighter.
It costs about $30 per month per patient. And, you know, in the UK and US, that doesn't sound like a lot of money, but you know that in our part of the world, spending $30 a month just for the medicine. Then there's the blood test, the full blood counts. They have to get blood tests every 4 weeks. There are full blood counts. There's some other special tests that we do to see how your liver and your kidneys are functioning, whether you can continue to take the medicine at the same dose or decrease it. So many people couldn't afford it. Their child will start on the medicine, maybe after 2 or 3 months, they say we can't afford it anymore. So the best thing would be for us to be able to get that covered by National Health Insurance. Well, the new batch that Novartis sent to Ghana in March this year was selling at less than $15 a month. That was less than half what is priced. We know that there's a new batch coming, and tomorrow there will be an announcement about the new batch. It's coming with a larger amount and will be even much cheaper.
Professor Kweku Ohenefrempong added that one of the major challenges affecting the treatment of the complication is inadequate research in Ghana.
If all the treatments and all the research is done elsewhere, then our own healthcare professionals tend not to believe the findings because they were not part of the testing, and that has slowed down the ability to move forward with sickle cell treatment. The first thing, I'll give you an example. It was determined back in 1986 that young children with sickle cell disease should be taking penicillin twice a day for at least the first 5 years of their lives. Still in Africa, there are young children with sickle cell disease diagnosed who are not taking penicillin because the doctors that are taking care of them or nurses somehow don't believe that it's needed. If those trials had been done here in Africa, people will know that Nigerians have shown that it works that way, or people in Kenya show that. They will tend to believe it. And when they have to read something before they can find out what to do, often many doctors don't have the time to be able to devote that time just for the few sickle cell patients that they may have. So many times they're not even aware of the need for even the simple thing like penicillin, taking it twice daily.
The head of Global Health Novartis Pharmaceutical, Dr. Patrice Machamba, cautioned health practitioners in the administration of the hydroxyurea drug to children.
Is that currently the only hydroxyurea available is a capsule. It's not even child-friendly. So the nurses have to take the capsule and break it up and remix it for the children. We as Novartis are working on a child-friendly hydroxyurea, and hopefully we can get it available in Ghana, in West Africa and the rest of Africa in the next 1.5 years.
Ghana and Novartis Pharmaceuticals signed a memorandum of understanding in January 2019 to improve the diagnosis and treatment of persons with the disease. Come your first reports for Joy News.